Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. San Juan Regional Medical Center is your community hospital, committed to making life better for the communities we are privileged to serve. In fact, better is our mission, improving lives through personalized health and care. What matters most to our patients matters most to us, offering a comprehensive range of inpatient, outpatient, and emergency care services so you can get the quality care you need right here at home. San Juan Regional Medical Center, celebrating life better here since 1910. "11 minutes past 8 o'clock. It is Tuesday morning, the 28th day of June, 2022. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico. Streaming everywhere else from our website, ksje.com. And coming soon, we'll be back on the air in Durango at 103.3 FM. So as we say in this business, stay tuned, everybody, for that. Welcome also to our viewers who are joining us this morning. The video is streaming live this morning to the KSJE Facebook page, our YouTube channel, and our Twitter account. So we're glad that you are with us this morning, everybody, as well, because coming up in the next few moments, we're going to be talking about Cenikor, the addiction recovery company. They have taken over Four Winds, and we'll talk a little bit about that and what that means for the local community and much, much more. That conversation in the next few moments right here on KSJE this morning. Later on this hour, I'll be checking in with Amber Francisco from the Farmington Regional Animal Shelter. She'll be sharing with us some of the pets available for adoption this week, including Quentin. That is the dog you see on the screen right there. He is ready to go. So we'll learn more about him coming up this morning on KSJE. Next hour, Mick Hess will be here roving with the arts. It is our classical music program, of course. Mick is featuring music again today from Bach, more of his Brandenburg concertos. You heard some of those yesterday. He will complete those today. You'll hear it coming up today at 9:06 on KSJE. Don't forget, we also invite you to connect with us on our Instagram page, in addition to Facebook and YouTube and Twitter. And if you're a podcast person, we remind you that KSJE podcasts are available for free wherever you listen to podcasts. So subscribe and check it out. There may be a program you haven't heard yet, and you can find them on iTunes and Spotify and iHeart and Google Podcasts, Pandora, and the list goes on and on and on. So check it out and subscribe and take us with you, of course, wherever you listen to podcasts. Outside our studios this morning here at San Juan College, it is a beautiful sunny morning so far. Here is the scene from our recently reinstalled weather cam here at San Juan College. You can check it out, a 24-hour view of the college anytime, day or night. Outside, sunshine, 66 degrees at the moment, and we are expecting a mostly sunny, warmer, and drier day today. Today's forecast calls for a high of 86 in Farmington this afternoon. Partly cloudy overnight tonight with a low near 60. Partly cloudy tomorrow with a high near 89 on Wednesday, and maybe another chance of showers beginning Wednesday night, and then showers in the forecast again, possibly on Thursday, Friday, Saturday, and early next week, with highs, as you can see, mostly in the lower to mid 80s and overnight lows in the mid to lower 60s. Well, let me introduce my guest, who is here with me this morning, as I mentioned, to talk about Cenikor. She is the facility director of Cenikor Farmington. Jolene Schneider is here. Good morning, and thank you for coming in this morning.
Good morning, Scott. I'm happy to be here.
Good to have you here, and we have to talk a little bit about Four Winds, and then we'll move on to Cenikor. But, of course, Four Winds Recovery Center was the name of the facility here for a very long time, and in May there was a ribbon cutting, and Cenikor announced that they were now going to be running that facility.
Yes. Four Winds was established in 1978 and served clients continuously for 44 years. And, we believe we provided a very valuable service to this community and to our clients. We had 100,000 basically in the 44 years. We provided detox at one time. We provided outpatient services, residential. And really, I got a call from Mr. Bill Bailey, who's the president of Cenikor, in about December of 2019. And we started talking. And he shared with me Cenikor's philosophy, Cenikor's mission and values, and an interest in moving to New Mexico. And then COVID came.
Right. Yes.
And that kind of,
Changed a lot of things.
It changed a lot of things, a lot of
right.
perspectives. But also the landscape was changing for funding and the way services were provided. And really, as much as Four Winds had done for this community, it became fairly clear that financially we weren't going to survive for probably another 2 to 3 years. And Mr. Bailey and I continued to meet. I went to Houston. I toured a facility there, spent some time at the corporate office, and really felt that Cenikor shared so much of our philosophy, our values, and our mission, our concern for the client, number one, in our community.
Very good. And I was going to say, too, for much of that 44 years, if not all of it, right, Four Winds operated as a nonprofit.
Yes, always.
And so that has its own challenges when it comes to funding and grants and things along that line, as you well know.
Very much so. And when we moved to Medicaid with the expansion, we had, prior gotten state funding, and the state really directed everyone to become a Medicaid provider. And that in itself was a daunting process that took Four Winds probably about 8 months before we could even get to that point. And still struggling to work with all of the managed care organizations. And everything had changed. And Cenikor has resources. They have a verification of benefits department. They have a billing department. I mean, they have so many resources. We were very humble. We had 3 people in our administrative staff. So we had a biller, we had an HR and payables, we had me. Every dime that came back into the facility went for salaries and providing services, because that's what mattered most.
Right. Sure. And it's kind of that economies of scale, I suppose, too, right?
Yes.
And as you were telling me, Cenikor is based in Texas, has a lot of facilities in Texas. This is the first now in New Mexico, in Farmington. And so they are looking maybe at expanding elsewhere in our state, maybe other states as well. But as you mentioned, the reason that you kind of began having conversations with them is because their mission seemed to match a lot of what Four Winds had been doing in the community for 44 years.
Yes, very much so.
Very good. Well, talk to me about then Cenikor, as we mentioned. So there's ribbon cutting. And so you are now part of Cenikor, and you are the facilities director here in Farmington.
Yes.
Of Cenikor Farmington, and the mission continues and the work continues. Correct? There was probably not really any stop or anything.
There's really not. No, we
changed the name.
We changed names. We had a transition really at midnight on June 1. May 1. I'm sorry.
May 1st.
May 1st. Yes, and the ribbon cutting later that month.
That's right. But
essentially, it was about just changing our client records into a new system, but nothing changed in terms of the people being served. If anything, it's made it a little more accessible. Cenikor has an access center, and when people are seeking treatment, they contact that access center, they do a pre-screening, and they put them right on the schedule for admission. Some of them are in within 24 hours.
Which is amazing, right?
It really is. It's not something we were able to do before.
Right. And there's a 800 number too, right? If folks are seeking help, that they can call any time, and that's also I don't think you were able to do that either, were you? Or
never.
Have someone on call for 24 hours a day?
Not at all. And this access center is 24/7, 365. The number is 1-888-236-4567.
Okay.
And the access center is headquartered in the corporate facility in Houston. But again, it's staffed 24/7. They will talk to people. They will talk to your family. If someone's not quite ready and the family wants to call, they'll talk to them. But really, they get that information. They get that person scheduled on our schedule, and that person can be in our facility within a matter of hours.
Right. And so the work that you've been doing continues. And so just remind us a bit about what services are available at Cenikor Farmington now, similar to what was available before, but just under this new
Yes.
this new name, and maybe with a few more resources that you were able to offer before.
Definitely. We are currently providing short-term intensive residential substance use treatment for adults. And that is, the traditional 30-day stay. We also do provide 90-day for clients on United States probation. We have a contract. However, there's much more in the works.
Right.
We are going to reestablish intensive outpatient. One of the first things we want to do is start providing MAT treatment, because we understand how difficult it is for people who are involved with opioids to be able to get into recovery. And our next really primary goal is to open a medically assisted withdrawal management program. And that program will be a place for someone who, and alcohol as well, but someone who's using opioids or alcohol to come in and essentially medically detox and prepare for the next stage, which
Right.
could be residential, could be IOP, really depending on, where they're at and what their needs are. And we are ready to go with that as soon as we hire some nurses.
Well, there you go. And there's a shortage, isn't there?
There is a shortage.
So you're in the same boat as everybody else, it sounds
We
like.
are. However, we are extremely flexible.
Okay.
We are doing a sign-on bonus. We are doing part-time, full-time. If somebody wants to work 1 day a week, that's okay.
Okay. You'll talk to them.
We'll talk to them.
Okay.
It doesn't matter. 5 days a week, 1 day a week, 12-hour shift, whatever they need. If they're already working and they just want to do something to make a little extra money,
Call you.
call me.
Okay.
Go to my website, thecenekor.org.
Okay.
Look at careers, and
That's the best way to reach out, I
That
guess,
is the
right?
best way.
To get the application process going, or
Yes.
send an email to say, I want like more information about your nursing position
yes,
or
definitely.
whatever, right?
Definitely.
Very good. My guest this morning, Julian Schneider, is with me. She is the facility director of Cenikor Farmington, formerly known as the Four Winds Recovery Center here in Farmington. The work continues for recovery, and this is a really important job that you all do and that you have been doing for decades now in our community, because we know just how invasive some of these addictions are, and how difficult it is maybe for people to realize they need help and to take that first step to maybe reach out and call somebody or have a family member call somebody and show up at your door, right? I mean, this is a
Yes.
big deal.
Yes, it is. And it is accessible. We are there. And when someone comes in, the services provided are numerous. I mean, clients, they're assigned a counselor, they do group therapy, they do psychoeducation, they do alternative activities, they do some spiritual work, and about 70% of my staff is Native American, which is fantastic because about at least 60% of my clients are Native American. We are working on expanding some of those services as well. Our next step with that, we are building a sweat lodge, and we will be building a hogan, and we will be working with traditional healers to help us with those services.
Very good. And that's really important, I think, to have culturally sensitive and culturally relevant treatments, right, for
Yes.
folks that are coming to seek out that treatment.
It
right?
is very important.
And that's a good thing. Talk to me a little bit about, and so we're talking mostly about addictions to alcohol?
Alcohol, opioids, methamphetamine. I mean,
Right.
we can treat at the moment. We can treat any substance addiction.
Okay.
What we can't do at this point is the medication withdrawal
That's different.
until we get those nurses.
Gotcha.
We have a medical director. I do have a full-time RN as a nurse manager, and I have one part-time RN. But I really need 24-hour care in order to deal with those medications.
Right. And for the most part, it's a 30-day
For the most part, it is.
treatment.
We go through, the authorization process, which is so much simpler now that Cenikor does it.
Right, right.
They have their department, and most of the time we get at least 14 days, but sometimes we get 30 right off the bat, and then we will, through our services, through the counselors work with the client and our documentation, be able to justify and show why this person needs to stay longer. So we really haven't had any issues with anybody being approved for less than a month.
Gotcha. And that is a pretty good time frame to really start that?
It is
breaking
just
of that
the beginning.
addiction, right? Because it takes a while. I would think probably more than 30 days in many cases.
Much more. And so what is just as important as what happens in the 30 days is what happens day 31. And that's why we have a case manager who is actively involved in not only working with the insurance companies' care managers, but also other providers here in the community, so that when the client leaves our program, they have somewhere to go to get continued counseling, to go to 12-step meetings, medical care, mental health care, whatever they need. We do provide limited mental health medication management and evaluation. We have a contract with a psych nurse practitioner. Mm-hmm. And so we're able to address some of those issues. But really, at this point, referral is the most important part of what happens when a client completes our program.
Right. And to maintain, I guess, some of that support beyond that 30 days that you can provide, right?
And once we get our IOP back in operation, we will be able to, in theory, have a client in withdrawal management, move them to residential, step them down to IOP.
Now explain what IOP means,
because I don't know. IOP is intensive outpatient treatment.
Okay.
And it generally is 3 hours a day, 3 times a week, and then an individual session every other week for at least 12 weeks.
I see.
And then once the person has completed that, they step down to an outpatient, which is 90 minutes a week for 24 weeks. So really, that gives us the opportunity to engage with the client for nearly a year. And the longer that a client is engaged in services, the better outcome, the better opportunity that they are going to maintain.
Right. And and we've been talking that this takes, it really is a commitment. It needs to be a commitment from both your client and you to work with them, right?
Yes, very much so. And so we have the philosophy that it doesn't matter what led the client to our door. What matters is what happens when they're in the program. And so there's no, it's not judging. I can tell you that the majority of our clients do come from the legal system. Doesn't matter to us because it really is about the changes they make. We have had some extremely successful outcomes with people who walked in the door and did not want to be there.
Right. And that was going to be my next question, was success stories and people that maybe have really made a big turnaround, and maybe some of the reactions that you get from family or friends or even from themselves who say, I don't want to be here, but I guess thank you, or something, whatever they tell you. Right, I don't know, right? How do they turn that around? And
they really much do. You see it the first week. There's always that adjustment.
Yeah.
And for one, it's a new environment and other people around that they don't know, rules, which they're not always accustomed to.
Yeah,
exactly. Right. And then having to focus on themselves. We try to remove as many distractions as possible. A lot with the homework and assignments and the groups that we do. And it's just amazing, by the end of their treatment experience, they're, thanking us. They're, wanting to shake our hands. We get thank you cards from families. We get calls from families thanking us. It's just a great thing. Reality is that's not everybody.
Sure.
But if we can at least plant the seed, if the client has enough opportunity in the program to know what recovery is about, you would be surprised a number of them do come back. Mm-hmm. Maybe 6 months later, maybe a couple years later, but they got just enough of a taste of what it could be like that they want it, and they come back.
On their own. Maybe.
On their own.
That's got to be significant.
It's great. I have to tell you, that's really why I think all of us do what we do. I was just cleaning out a desk the other day, and I found a picture of my first client who has now been sober about 28 years.
How about that?
So, it's like, wow. And he went on to be extremely successful. He did some teaching here at the college. He recently retired from a very good career. He's got a great family. And it's those those kind of things. And whenever you start to think, oh my gosh, why am I doing this? You remember that.
Right. That story to me sounds life-changing
Very much
from the
so.
work that you do.
Very much so. And it's not, it's not all easy, but it's extremely rewarding. We, work with people who have been through a great deal. Probably the majority of the people who walk in our door have experienced trauma at some point. And it's just all about meeting them where they're at, accepting them, but also helping them have the courage to do the inventory, to make the changes,
Right.
and to move forward.
I think many of us would be amazed at what people have been through in their lives, the trauma, the whatever it is, and why maybe they are the way that they are. But again, you meet them where they are, and then you can kind of provide those services. And I'm sure every client is different when they present to you, and so each treatment plan is probably a little different too,
Very much so.
as to how you get them out of that place where they are when they show up at your door.
Yes, and we've had the wonderful experience of having a licensed clinical social worker working with us who is certified in EMDR, which is, a practice with people with PTSD and other
Right.
traumas. And that's been very helpful so that we're able to kind of do the integrated versus a parallel, or, sending somebody out somewhere else for care. It just makes it, I think, easier for the client because they're in one facility, they've formed these relationships, and it gives them that sense of connection.
Right. Let me ask you a bit about these clients that show up and maybe they realize it themselves, or maybe their family has kind of strongly suggested that they come and see you. But is there any advice you have maybe for a family or friend of, because maybe many times folks are fairly functional
Yes.
despite their addiction. And so it's maybe hard to kind of tell that there's a problem when we meet them or interact with them.
Right.
And so what advice would you say?
So, I think some of the signs are not always easy to see. And I think sometimes if it's someone in your family or someone that you're very close to, you tend to overlook or try to overlook. But, there's things like moodiness. There's things like maybe money spent that there's no explanation, being late, not coming home. And it's a difficult place to be as a family member or a friend of somebody because, that person really does know that there's something going on with them and they need to do something different, but it's very difficult when you confront them. The first, instinct is to become defensive and to deny. And really, I think the biggest thing is to communicate to the person your concern, your care, and options. Ultimately, that person has to make the decision. The family can give someone an ultimatum and they can come into treatment, but if they really do not want to stop, they're probably not going to do it.
Right.
The family needs to take care of themselves and the friends. There's programs like Al-Anon.
Sure.
That are very helpful in helping family members or loved ones learn to take care of themselves. And it doesn't mean that you don't love the person with the addiction issue. It just means that you're taking care of yourself. Because the reality is, if you don't take care of yourself, you're not going to be able to take care of anybody else.
Right.
And no one human being is going to keep another human being sober.
Good point as well. And I think we learned a little bit about that during the pandemic.
Yes.
If you don't take care of yourself, you can't take care of your family or the others that depend on you with that kind of a thing as well.
Exactly.
And so that is certainly good advice. And since you really deal with adult treatment, right? And that's why they really have to be willing to come there and stay there and be treated, right, for the 30 days or whatever it is.
We are not a locked facility, so anyone is free to walk away anytime they choose to. Always with the awareness that if they happen to have a probation officer, we will contact them and let them know.
There are, those things happen, right?
It's choices, and maybe it's choosing between two things you don't want to do, but it's still a choice.
Sure.
And you need to make that choice and do what's right for you. I had somebody who walked away and didn't even get to the end of the road and was like, whoops.
Rethought something?
Yes, and so, they're welcome back.
Okay.
there's very few things that would keep us from taking somebody back.
Right, right. But there are certainly choices of consequences, some positive,
Yes.
some negative, and I guess that's
Yes.
what they learn a little bit too.
And some of them will do that. Some of them will end up being remanded and spending some time incarcerated, and then they'll come back to us.
Okay.
And while we are mindful of that when they come back, each experience is a new experience. We want to give them that opportunity and not hold it against them as far as their behavior in the past. We recently had a young lady who was involved with federal probation. She had been in our program last year, and she left after 3 weeks at, I believe, our request. There were some issues. She came back, and she successfully completed 90 days. She made it through that rough first week, but she did fantastic, has an excellent plan in her home community, and just a huge change. And it really was about her being ready, but at the same time, when someone walks in the door, they need to feel welcome. They need to feel like they belong. They need to feel that they're not being judged and that it's a safe place for them to do the work they need to do.
Right. Well, and I suppose if they're walking through your door for the second time or the third time, it's important for them to know that the slate is kind of wiped clean and that they are, you accept them as they are. You said that at the very beginning of our conversation today, that it sounds like, you just work with what you get.
Exactly.
When they show up.
And you never know. I mean, some people come in and, they used to call it rehabilitation, right? And some people come into our facility and it's not even rehabilitation, it's habilitation, because they never learned some of these skills to begin with. We really have to keep in mind where someone is coming from. What was their family life like? I've had folks in the program that don't know how to use a washing machine. Mm-hmm. Because they never did.
Right.
And it's those simple things. And we incorporate simple chores, ways to help them become more responsible, really with the end goal of, at some point, this person is going to have a job or be going to school. And so we help them to learn how to be on time, what's the appropriate way to behave. And it's so much more than just not drinking or using. And I think really that's part of Cenikor well beyond recovery, because it's not just about not drinking and using.
Right. And that, I guess, helps them once they complete the program.
Yes.
And again, that aftercare, I guess, too, which is so important to get them back on, maybe they've never been on their feet, but back on their feet and self-supportive and holding down a job and being responsible and contributing to society and all these things that I think we kind of take for granted, but a lot of these folks struggle with if they've never been able to, taught how to do it or learned how to do it or all those things.
Yes. And we work very much with our case manager, very much with Department of Workforce Solutions, connecting also with Goodwill has a job program. And it's just where are our clients at? Do they need to know what a resume even is or how to fill out an application? Or do they have some skills and they just need connected? We also take them to job fairs occasionally. We took some clients to a job fair in May. No, it was April. I'm sorry, the end of April. Mm-hmm. And one of them secured a very good job for when he was discharged. Good. So, you never know. And that's really important in the community as well, if employers are willing to work with people. I know Cenikor is a second chance employer. And, I think understanding that people have experiences, and yes, they have had some things happen in their past, but they are not their past.
Right.
And looking at who are they today and giving them a chance. Certainly holding them accountable for their behavior, but giving everybody the opportunity to be successful.
Sure. And for your clients, does seeing some of those positive things coming through after their treatment, does that reinforce maybe that they're on the right path and they really need
Very
to
much
stick with
so.
what they're doing and not fall back into those bad habits?
It does. And, and also if somebody does fall back for just a brief moment, it gives them the opportunity to learn from what happened. Relapse is sometimes a part of what happens in recovery, and it's really It's not to be ashamed of. It's to learn from. And if someone relapses, and yes, maybe they lose their sobriety date, they did not lose the skills. They did not lose the things they learned. And it's just about getting back up and moving forward, not getting stuck.
Good message, I think, for everyone to hear this morning. And Julian Schneider, we're out of time. Would you repeat that 800 number one more time for us, for folks who maybe want to reach out or maybe share it with somebody or someone that they care about? What's the number again?
Certainly, and this is the Cenikor Access Center, and it is 1-888-236-4567.
Very good. Julian Schneider, the Facility Director for Cenikor Farmington. Thank you for coming in this morning.
Thank you for having me, Scott.
You bet. Great to see you. And thank you for the work that you've been doing for a while now in our community. We appreciate it.
It's worth every minute.
Thank you very much. KSJE is supported by the Alzheimer's Association, New Mexico Chapter, with a local office in Farmington, providing free services and resources to help those living with dementia and their families, including their 24/7 helpline, 1-800-272-3900. The Alzheimer's Association, New Mexico Chapter, 1-800-272-3900. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello again, this is Evan Chi with Week 4 Coaching Tips over the radio. For Week 4, we will be discussing resources. There are many resources available on our college campus, both physically and online. Be sure to know these valuable resources. If you are unsure of their availability, do an online research using your college website. If you cannot find the resources on your own, be sure to contact the Student Achievement Center in room 1604. Resources can be found in the following areas: Library Services, Native American Center, Herencia Latina Center, Student Achievement Center, Career Center, Trio Center, Tutoring Center, Veteran Center, Financial Aid Office, Advising and Counseling Center, Disability Services, Business Office, Dean of Students, and much more.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.